Well, good morning. We're here with Christina and her daughter Claire, and we are grateful that you were here to receive dental care at Shoreview. And curious if you just tell us your story about how you found us.
Okay, my pleasure. So we've actually just moved from Salt Lake City to Seattle, and so we're not locals, and we did search this practice out. When my daughter was about 6 months old, she'd already had quite a few teeth, and I noticed some yellowing on her teeth. I was night nursing, and she'd started solid food, and I asked her doctor at that time about the yellowing, and he said, "It's nothing, don't worry about it, you're just being a nervous mom." So I didn't, and then at 12 months it looked significantly worse, and I made an appointment with a dentist, and also saw her doctor again, who still said, "It's fine, don't worry about it." Later that day, saw a dentist who said she has severe decay on her forefront teeth and she needs crowns across all forefront teeth, and that it would be performed under either general anesthetic, or I think, is it unconscious sedation? Conscious sedation.
Yes.
And with a background, I've got a master's in molecular biology, and with a background in working in the drug development industry, I wanted to understand the drugs that were being administered, that would be administered to her, and the further I got into it, the more concerned I got. Between the Mayo Clinic epidemiological study that showed the association of, the association between people who'd had 2 general anesthetics before the age 2, and I think it was a 37% incidence of a learning disorder, and then, a lot of what seemed like hand-waving to me about, well, it doesn't show causation and so forth, and that's fine until you look at the monkey studies on 5-day-old monkeys. I can't remember if that was propofol or ketamine, but it clearly showed neuroapoptosis during synaptogenesis. Same in the rats, and I think there's reason for real concern. So I started really digging for an alternative and found the use of silver diamine fluoride in other countries, and read a paper that said there was something like an 80% success rate in rural China. And I thought, well, if they can get 80% in rural China, I think we can probably do better than that with better monitoring and things. So I pursued that. My dentist hadn't heard of it. Someone from his office at the time, the office manager actually called me one night after I canceled the procedure and told me that my daughter could die, that the infection could go systemic and she could die and there's no alternative, and did I really understand how serious this was, and that sort of thing. So it was a really traumatic experience to be faced with this choice of what I read in the literature as brain damage versus a risk of dying, and which is not a good choice. And so I was quite happy to find someone in the United States practicing the equivalent of the silver diamine treatment, or something similar to it anyway, with the silver nitrate and the fluoride varnish. And we haven't done an x-ray in the last couple months, but she was still going back to that other dentist and having x-rays, and after, I think it was about 4 months of treatment, there was no progression at that stage in the decay, and so they were actually quite intrigued. I haven't been back to that practice recently, but I think things are pretty stable and doing well. So.
Well, thank you. It's a fascinating story, and with a scientific background, does it make sense to you to approach this with an antimicrobial solution rather than just needles and drills?
Well, I mean, it's craziness to me, really, that the whole practice of dentistry seems to ignore the underlying disease. You know, that there's an essentially an infectious disease that can be approached, you know, once you have active decay, something like the silver nitrate. But even prior to that, I mean, they say, like, oh, you shouldn't give your kid a lot of sugar, but I mean, there's so much to changing the bacterial strains that I think, or the what do you call it? The karyogenic strains that are in the mouth, and changing the flora in the mouth, and you know, nobody pays any attention to any of that, and so I think there's really a need in the field to do something besides just drill, because that doesn't impact the disease, really.
So we really are going back to basics, and it was astonishing for me to discover that dentists 100 years ago knew that this was a bacterial infectious disease, and they were using medicine to treat it. That medicine being silver nitrate. Silver diamine fluoride is a more modern iteration of that, but is not available in the United States. So, in any event, it's a delight to have met you and your daughter. We hope that we can arrest this disease, prevent it from progressing, and allow her permanent teeth to come into a healthy mouth.
Right, so. Yeah. Thank you very much.
Thank you very much.
We're glad we found you. So.
Great. Thank you.
Because we don't want it to be dark, because you are a very pretty girl, and we want you to have very pretty teeth. Okay, cool.
So it's just so when I was brushing her teeth, I mean, her teeth were fine for a long time, and then just this last week for a few days when I would brush her teeth,
Ignore it.
she stayed.
Yeah, it's an anomaly. Just those are normal. That's absolute. There's no depth to that. I've looked at it. I don't see any reason whatsoever. So this is 38% phosphoric acid, and all that's doing is etching it. We're just going to etch it for about 10 seconds, okay, just so that we can penetrate it. And the reason for that is that we're trying to get a little bit more porosity. So I look at the arrested caries as being the consistency of a charcoal briquette. Okay, so think of this as penetrating the charcoal briquette and opening even a little bit more porosity into that briquette. Okay?
Okay.
Then this is bonding agent that penetrates the porosity and goes deep inside and on the surface. Then this bonds with this together, and we get micro-mechanical locking into the porosities in the surface of the charcoal briquette. And it's only masks it, that's all. Okay? So it's actually purely cosmetic. Okay. Oh yeah, are we going to use air? If we're going to use air, we should tell Claire. I didn't even know we were going to use air.
We can. What do you think?
I think we dry it with this.
You don't think we need air?
No, I think we dry it with this. Okay? Just make it simple for Claire, you know. Okay, honey, bring your head back. Here we go. Okay, now, the first thing is the cotton roll. Okay? And what that does, I'll show you, okay? Keep your hands down, okay? Good girl. Are you all right? Cool. I'm going to put this inside your lip. How's that? Is that okay?
Not really.
No? Okay. Well, is it okay if I hold it like that? How are we doing?
You'll be okay for a minute, okay?
It'll only be a minute. I'm going to do this one on this side first, okay, Claire? Try not to push that with your lip, okay? You're doing good. I won't push hard either. I'm putting the tooth soap on. You ready? Here we go. Now let's have this. Back it in here. Okay, now wait. I got to wash it. Ready? This is just some water. Okay, that's all this is. Just water. Good girl. Oh my goodness, you're doing so good. Now I need to dry it. So I got to dry one of those. Maybe this one. This one's good. Okay, hold on. Here we go. You are doing so good. What a good girl. Okay, now can I have my bonding agent, please? Yes. Awesome. Just a minute. Let me just make sure I got it real dry. There we go. Okay, now I'm going to put this on. Don't move, okay? Hang in there. Good. Now, hold on. I got a little bit too much. I don't want too much on there. I just want enough. Good. Dr. Steve's going to set the light on it. Go ahead. You do it. He's putting the light on. You okay? Everything good? Oh, you're being such a good patient. You're just awesome. I'm so glad I got a chance to meet you finally, because I heard all about you. Now I'm using the paint, okay? And I'm spreading the paint on. Good girl. And I'm masking the black scar. Isn't that cool? Mommy, it's not real translucent. It doesn't look like a real tooth. It looks more like a chiclet. But that's better than black. That's the way I'm looking at it. See, I'm spreading it on there, Mom. That's sweet. And then I'm just gonna take this back just a wee little bit. Good girl. Go ahead, Steve, set that up. Good, now we're gonna just set it up like this. Oh my gosh, you're being so good. You're the best patient I ever had. How old are you? How old are you? Tell me. Are you 4?
Yeah.
Oh, I thought you were 14.
Yeah.
I thought you were 14. Yeah, look at that. Isn't that nice? Yeah, good. Now we're going to come over on this side. Okay, and we're going to use this one.
Oh.
Are you okay? You're okay. Don't worry. Tell me if I'm pushed too hard. I don't need to do anything forcefully, honey. This is all super easy. Awesome. So, I had this kid that was younger than her. He was 2. And the parents brought him in, and I applied silver 3
Is
times.
it hard?
No, same thing, huh? Same deal. Just water. Just water. Just
She
water.
needs spit.
Just water. Good girl.
You're okay.
Good. You're doing good. Okay, yeah. Don't close. Don't close. Good girl. You're doing awesome. Good. I'm just drying it.
Grab some.
And okay, Bonnie agent. Here we go. I'm just painting this stuff on. Don't worry. You're doing just awesome. This minute, I got a little bit too much on there. Go ahead, Steve. Dr. Steve's gonna put on there now. Here we go. A little bit over this way. Good. Good. You're good to go. Good. Okay, now we're gonna make it white with the paint again. You ready?
Okay.
Good girl. And his name, this little boy was 2. He was half as old as you, Claire. And guess what? His name was Owen. O-W-E-N. And Owen was only 2 years old, so he wasn't quite as well behaved as you because he wanted to move around a lot, you know what I mean? And I did this, and it's lasted for almost 8 months now. And go ahead, Steve, you can set that up. And Owen has the same kind of situation that you have here. And his teeth, he went up, after I did it, they went on the road, they went to Texas, and they're living in a van. And Mom wrote me the other day, I sent you the pictures of, and he got a little chip. Okay, so the corner of it chipped a little bit. And I told her, don't worry about it. Whenever I see you the next time, we'll just dab a little bit more. He's in Maine. They're from Maine. And I'm just going to do the same thing. Oh, so reapply. Sheldon. So just reapply. So painless reapplication. What does the reapplication involve?
Can I
This.
go look in the mirror?
You bet, honey.
Come on, let's go look in the mirror.
Right, so we're very happy to be with Claire and Christina again. Welcome.
Thank you. It's our
And
pleasure.
it's been about 3 years since we started treatment with Claire. And so tell us a little bit about this most recent trip out to see us and what we did and how it caps up the treatment that you selected for Claire.
Sure. So Claire is now 4 years old, and we started this when she was 12 months old, and she had a little staining on her front teeth from the treatment, which, well, you know, before school started and things wasn't a big issue for us really, but as she gets older, I was a little bit more concerned about the social side, and so we decided to do this procedure to cover up the staining with the white, I guess, glass ionomer resin, and so we did that. And can you smile? You want to smile and show? Can you smile big? Show your teeth? Yeah. So we're happy we made the trip. It's kind of finished this little journey for us, which has been a worthwhile one. We managed to avoid the general anesthetic and the sedation drugs, which was really important to me. With you know, the possibility of doing some damage to the brain. So,
Well, good. And we're so happy that Claire is healthy and beautiful and growing up and no problems with tooth decay anymore. And I'm kind of curious how you felt about this last step being done in the kitchen, literally, not in a dental office. Did you find that rather interesting?
yeah, I mean, it was amazing how seemingly easy it was. And Claire, let Mama talk, okay? So Claire, what did you think? Can you talk to the video? What did you think about having your teeth done last night? How was it?
Well, I really liked it.
You really liked it?
Did you like Dr. John? Yeah, he's fun, huh?
It wasn't too hard, was it?
Didn't hurt, huh? No. It was easy.
Yeah. What did he do to your teeth?
Well, he put this white paint to make my teeth white again.
Yes. Perfect. And it was easy, huh?
Yeah.
Good. Well, I want you to do lots of smiling because you're so pretty, okay?
Okay.
All right. And you can come and visit us anytime you want. And maybe we'll come visit you sometime, okay?
Okay.
Thanks for coming to visit us, okay? Have a safe trip home.
Thanks.
Bye, guys.
Bye.